All right, listen, thank you everybody for joining us on the call today. I'm Jason Bennett, I'm CEO of Unna. And of course, we're here to talk about the normalization or the modernization of health plan technology in the new normal. So before we get going, just so you know, we'll send out the recording. Feel free to ask questions anytime. And there is a survey at the end. It should take about no longer than 30 seconds. We appreciate you filling that out. So I'd like to introduce our speakers today. So Dr. Rania Nasis is not only a physician entrepreneur, she's also the founder and CEO of Starlings, where she's helping health technology startups from zero to A round. And that's covering everything from apps and systems to hardware. Also, Mr. Chuck Kiskaden, he's a seasoned executive in marketing and operations in the healthcare industry, has worked for the big payers, TPAs, and brokerage firms, as well as for more than 10 years has been the president and CEO of Health Benefits Advisors. And then myself, your host, I'm Jason Bennett, and I am a seasoned technologist and leader in taking enterprise SaaS concepts to market at scale. I specialize in building teams and building business units. I've worked in the Fortune 100 down to startups in the arena of healthcare, telecommunications, as well as the federal government space. So as you know, today we're here to talk a little bit about what to expect in the new normal, how technology is evolving, and we're also going to look at who's going to benefit in this modernization of health plan technology. So we're going to dive right in, and we're going to talk a little bit about, with regard to health plans and health benefits administration, what can we expect as part of the new normal? So it may come as, it's a shocking number, but it may not come as a surprise. But in July, it was estimated that nearly half of the workforce in the United States was working from home. Obviously a huge number. But what's more interesting, that the fallout of this is not only was it that experiment that taught employers that, hey, this can actually work. But what we're seeing in the market is that, especially in the small to medium enterprise level, is employers are downsizing. They are moving out to the burbs. And maybe more importantly to this conversation, they've realized, well, wow, since this works, we can hire anywhere. So hiring models have changed. So even in this time of unemployment, employers are now saying, well, if we don't need everyone in the office, and for those that can work remotely, we can hire from anywhere. So when we think of how we're providing, managing, and people are utilizing their benefits, obviously we need to be quite dynamic in determining how are we designing these plans. Where's the place of service? How are they getting healthcare, right? There's a number of these facets that are changing in real time and will continue to do so for long term in the new normal. Next, we look at cost containment. So cost containment, obviously, it's not surprising again. However, if you look at the numbers from PricewaterhouseCoopers, has been doing a running survey, and nearly the majority, if not close to all CFOs surveyed, are kind of wiping the slate clean and looking at new cost containment measures, right? And just as in our previous slide, that includes changing office footprint, potentially moving, and with nearly half of those surveyed saying, look, we're putting things permanently in place to allow for remote work, assuming that those that are remotely working fall into a job category that they can do so. What this is doing, and everything that's going on in this pandemic is going to further bolster the boom in employers moving to self-funding, right? It's also has CFOs and HR leaders getting more involved in their plan design. and also asking for creative solutions, whether that's reference-based pricing, whether it's can we include direct primary care options. So when we're designing plans and we're using technology, we need to be very obviously dynamic, and we really need to come through as a partner to our employer group customers who are looking for help in navigating this and obviously saving money. And of course, digital transformation, which we'll talk about here in a little bit towards the end of this presentation. And the final thing is, of course, the focus on productivity. With all the changes, remote work, the stresses, the anxiety, the high unemployment rate, obviously you can imagine at present state, there's a great deal of anxiety. Employers, obviously for the employees they have left, they want to be able to communicate effectively and provide not only healthcare, but programs that will enable productivity, of course. If you want, you can click on this QR code with your phone, just snap it. You can go to an article I wrote recently about this very topic where it covers the why, who, and for how long. Because the thought here is that this is not just because during the pandemic, but in the new normal, you're going to have long-lasting anxiety, fear, which obviously exacerbates current conditions and other fallout, which is going to be very concerning. So what does this mean for you? That means you're going to see kind of an explosion in programs. But what employers are going to be looking for in their vendors is to not be vendors, but be partners and help us if we're implementing new programs or evaluating programs that are in place to help with productivity. Can you help us measure efficacy? Because as we know with programs, sometimes these programs can take a year, 2 years or more to really understand, are they providing value? And obviously in a time like this, employers are going to look for better results than that, right? So really these three key areas, we look at being more dynamic and being more creative in plan design and how you're managing and administering those plans, as well as being more of a partner, not just a vendor to your customers who are expecting this and near demanding it as their dynamic change is happening. And of course, your ability to not only include programs in your plans, but also can you help gauge the efficacy of that program in the short term? Okay, so there's things that we need to be aware of, but now let's look at how technology is evolving that will help in this entire process. Before we look at key trends, I thought we would look at some of the economics and the economic theory around, let's validate why modernization is coming, right? So in doing so, we look at these innovation cycles, right? So in economics, the theory is that innovation cycles happen, and they happen in waves that are progressively getting shorter. So those waves are progressively getting shorter. And as you can see from this diagram, many would agree that we've just come out of the fifth wave. So in that short time span, as we've gone down from a 60-year innovation cycle, you cut that in half down to 30. Now, another complementing theory is that disruption. At the same time that our innovation cycles are happening, disruption is happening in those cycles at an exponential growth rate. So what you have is progressively evolving and shortening of innovation cycles with increasing amounts of disruption. So recently, Deloitte put out a really good study on the parallels of healthcare and technology in the fifth wave. So the concept of healthcare 1.0, web 1.0. So in the 90s and into the 2000s, healthcare was largely about the institution. And that's where that was our ultimate definitive reference source. In some way with the web was largely, okay, look, these are what these companies are doing. We can go find them on the web. but it was very much just, it was read only, right? So as we move through this fifth wave and into the 2010s, where healthcare and the web were evolving to 2.0, which basically said, okay, well now we've got a lot of focus on the doctors, and we're determining who we choose as a doctor because now we're more active on the web. Look at social media, how we've started focusing on communities. Now we're all sharing content and sharing the good, the bad, the ugly, of so on and so forth. So this is, in essence, health technology 2.0. So the argument is that now we've reached the end of that fifth wave, and now we're into this sixth wave, where healthcare has finally turned into focusing on the consumer. So some would say the consumerization of healthcare. But what we've evolved into is now we're entering that realm of health technology 3.0, where the web is about the individual. We've got all these new avenues and influencers and enablers for how are we taking ownership of our health, and how does this technology and healthcare emerge. So when we think of innovation and disruption, what a better time. So when we think of the pandemic that we're currently in and on a path to get out of and into the new normal, obviously innovation and disruption are exacerbating, right? So it's accelerating at a rapid pace, and that will continue here in the short term, and we'll just see how long this innovation cycle in the sixth wave lasts. So understanding that economics and getting to the point of health tech 3.0, let's talk about the trends in health plan technology. So for everybody's benefit, we're deeming health plan technology really as anything that helps with the planning, the design, the implementation and management, as well as the utilization of group health benefits, okay? Any technology that does those things. So we know today that, and still a huge issue to this day, is that healthcare is really behind most industries in interoperability. It's estimated that about 2/3 of all health IT systems can't speak to each other. They don't share data. And that's either because they're archaic, that's because they're obsolete technologies, or if you look at over 2,000 EHRs, electronic health record systems, a lot of these guys just don't want to share that data yet. But what's changing in innovation and entrepreneurism is that bringing to the market open systems. Open systems allow us to really use modern technologies architected with HL7 standards and connect to, well, just about anything, whether that's your partners, providers, even your back office. Open systems have the advantage of giving both administrators, planners, a 360 view of not only the current population and trends, because you have more data to evaluate and correlate. So you get a better view, so that not only in doing so are you lowering administrative overhead, but you're optimizing your business and your workflows. And obviously there's a number of improvement outcomes that come with being an open rather than a closed system. Number 2 on our list is just big data. Big data has been around for quite some time. It's a great buzzword, but the cost that big data can fix are astronomical in the healthcare arena. An easy point is this small number of 21 billion annually. With big data, groups like Drug Bank, other access to CMS drug pharmaceutical information, using that big data can save huge amounts of money at the micro and macro level, because that data is available, it's relevant and up to date. And that's just one example. But where big data comes into play, especially as you have open systems, is that when you're making plans and you're designing plans, right? Having the availability, not only of benchmarking, but having real-time cost and quality of service transparency, that's what big data brings to the table. So you're implementing plans that we know or have a much more likely chance of being successful, and you're gaining the confidence of your customers. Now, this can go to the nth degree in the advantages of big data, especially in correlation models, and how we can prevent gaps in care, what are good modeling, doing evidence-based or more accurate reporting, and the list goes on. But now if we look at, okay, we've got some open systems, so now we're access to more data. We're using big data to really enable better decisions, but now we start looking at how analytics is becoming smart. Analytics is that common buzz term, right? So we've all know about analytics. Everybody's using analytics. But just for the purposes of this discussion, let's just look at real quick, what is analytics in our world, right? So there's three types of analytics that we focus on. Obviously, descriptive. We all know predictive. And over the last couple of years, we've seen the rise of prescriptive. So predictive and prescriptive both use more modern cutting edge technologies, but really it's what will happen. And then when prescriptive is on the scene, it's okay, great. Now I've got options and taking it to the next level. So really what it comes down to is, because you're seeing this everywhere now, is actionable. We believe that actionable should be split into two realms. It's actionable data, which again, we go back to predictive, and then it's actionable insights. And where insights is a game changer is that systems now having more access to data, more fluidity, and becoming smart or smarter, systems are able to not only tell you what happened, but here's what you could do to make sure it doesn't happen. Here's the benefits of doing so. Here's some options, and here's the step-by-step. And in short, that is the element of actionable insights. But what that gets us in this realm is not only across the spectrum of health plan technology and the benefiter, those who benefit from it, is really it gives us a great deal more accuracy because of smart analytics. It's also enabling smart decisions at every level of ecosystems, populations, micro-populations. It really is that game changer that can really help in exacerbating our ability to, I almost want to say automate, but to actually change behaviors when used effectively. So this really brings in the efficiency, optimizing your business and how you conduct, how healthcare is utilized and how we use it going forward. So this kind of all rolls up right into whole system design. So the big number on here, 200 billion, is just a subset of, you can calculate the mass amount of money from fragmented systems. Healthcare, again, very fragmented industry. That's on the payer side, it's on the healthcare systems, even down at the micro levels of, at the TPA level, the brokerage level, we see a number of fragmented systems. So not only does that present further interoperability issues and understanding utilization, but by having fragmented systems, your total cost of ownership can sometimes just go through the roof. Multiple support systems that don't talk to each other, it becomes very expensive, time consuming on a number of fronts. So what is the whole system design? So when we think of whole system design, it's using modern technologies that obviously you bring in the factors of, okay, I'm more secure. This is all my system. It's under one security realm. But now you're bringing in systems that are tying in, I'm going to say it again, ecosystems, whether that is a benefits administrator serving clients that are groups, employer groups, members, and now who you're talking with on the back end, from providers, clinicians, claim systems. What's coming in the market now is that whole system design where it's folding all of that in. It may not necessarily mean that everything is in one system, but by being more open and having more secure and the modern technologies that are generally infinitely scalable, you can now start bringing everything into the fold. Okay, we'll follow up on this more in here in just a minute. Okay, Number 5. So as we talked about, if you think about health technology 3.0, we looked at the parallels of how healthcare has evolved, how technology is evolved, and it's very consumer focused, right? We also know, and this, we look at how your end users and how people, their experience with mobile apps, with analytic screens, dashboards, that experience gauges whether this is going to be useful for them, which if it is, that's what you want. You want utilization from your end users because it optimizes your business and it empowers them and it brings them into the fold. So one question I often like to ask when we talk about, you know, the value of experience-focused design and how that's coming into the fold in these unified systems, is the real question is, if you think about the number of apps that are used in every realm of business, from small to medium to large companies that deal with operations, sales, marketing, development, they are these enterprise-wide apps, they're consumer grade, and they've got great ROI. But with healthcare costs on everybody's mind, and how are we making our employees healthy? How are we delivering the best quality of care? Why isn't there technology for healthcare and keeping people productive? Not just members, not just employees, but the entire realm, and as you're connecting the dots. It's a very interesting question, and modernization is answering that question by stepping up to the plate. So when you deliver your systems, and as your systems evolve, the more experience design, it really does instill ongoing utilization, which is a key factor in optimizing your business, gaining buy-in, lifetime value. The list goes on. But what you're really doing is, now that you have that utilization and you're enabling your user base, whether it's internal, external, whatever the case may be, you are enabling smart decisions. And that's where you start getting whole system cost-saving opportunities, okay? So now we get into the final leg of this, and that is, which we skirted the discussion around digital transformation. So let's talk about that. So this astronomical number is what we've seen over this last summer, and the number of telehealth claims submitted over the last summer. That's the growth in that, and maybe not surprising because we see it on the news and on LinkedIn and in the news all the time. Telehealth is catapulted 5 years, if not a decade, in its market growth and its potential. And in the new normal, that will be a remaining factor. But what we submit is that it's not just telehealth. Telehealth is a component. A number of surveys and reports have come out just in the last 30 and 60 days, showing that as people are remote and there's anxiety, people are looking for that social connection through their employer workplace environment, the ability to bring on connected health. That's using technology that incorporates not only telehealth, but also all those other aspects of engagement, of integrating with everything from wearables or anything that people are using in their lives today, because now people are taking more ownership of their own health and wellness as part of our model in Health Technology 3.0 shows. So as we're focused on doing that very thing, what's interesting is now we're seeing how we can evolve with this modernization trend, how you'll evolve and really kind of create a culture, health, and financial alignment through your back-end technologies that extend throughout your population. So with connected health, meaning you're giving apps and portals to your employees that they're actually using. And you're doing so in a consumer grade experience, which actually promotes that adoption. And now you have an opportunity to get more data. That's utilization data, real-time health data. And you gain a much greater understanding, and it gives not only in plan design, utilization, but now you're starting to understand, okay, now we have a real 360 view of our population. And that will grow over time. In the new normal, it'll exacerbate, but you'll continue to see this evolve through employee-led apps, right? So, okay. So what does all this mean? What I like to summarize in how we're modernizing to meet demand in the new normal, how innovation is accelerating, and really more and more companies, more and more organizations will start adopting that data-driven culture. And what that means is that people really start owning that, hey, everything we do is going to revolve around the data. We have more access to it, we trust it more, and now as company cultures evolve, it's all around the data. So when you consider whole system design, data-driven cultures, then you start bringing it into the fold, just like our model of Health Tech 3.0 suggests, by being more experience-centric around the technology that you're deploying. You're enabling entire ecosystems and populations to really come together and evolving how we use, how we pay for, and how we improve our healthcare in this country, right? Okay, so a couple of final things. So let's talk about the aspects of who benefits. And I've been doing all the talking, so I'm going to open up to our speakers here real quick. When we look at employees and their families, right, and how they benefit. And Rania, I really wanted to get your input on this because I know this is close to home for you. What are your thoughts?
Yeah, I mean, I think it creates a win-win situation. One, employees are happier. In many ways, it can help increase productivity. For instance, we talked about the explosion with telehealth. You won't lose an entire day taking your kid to the doctor, right? Right. You really remove some of the aggravation that they have. Also, it's about finding the proper incentives, right? How do you incentivize employees to be as healthy as they possibly can be? And how do you make it easy for them to make smart decisions? Many times, employees have all sorts of benefits that employers are spending good money on, and they have no idea how to find them. They don't know what's available to them. How do they access those types of benefits? So having a place that they can get to and see what's available to them, an easy way to access it, definitely helps with employee satisfaction, job satisfaction as well too. Healthcare coverage is a big factor when it comes to picking who you're going to work for, whether or not you switch jobs. And so from an employer perspective, it also is sort of a recruiting tool and making sure that you're keeping your high quality employees and they're not jumping ship. And that, such a big deciding factor, particularly if you're someone that has a family and you've got your entire family on your plan. Healthcare is a really big part of the calculus that you do in terms of where you work. And I think now with COVID, you're seeing sort of a demand for other types of services. For instance, you sort of touched on mental health. And it's mental health almost in a different flavor. Traditionally mental health services have been psychiatrists, psychologists. Now it's becoming, peer support groups, anxiety focus groups, more coaching type things. And so that's another way to sort of show your employees that, one, you care about your health and that you're making it easy for them to do the best things for themselves and making sure that they're being healthy, which will in turn make them more productive employees. And so I see it as really a win-win situation on both sides.
Oh, that's great insights. Thanks, Rania. I did realize too, and we've talked about this, and hopefully some of you have seen this, when we start talking about delivering health-centric apps through the employer or through insurance, through TPAs, there are regulations that may go into action or may go into effect that people need to be aware of too. It's just an FYI that cost transparency, if you're delivering health-centric apps to employees, that you may be required to have cost, not only cost, but quality of service transparency built into those apps. So it's going to be an interesting end of summer as we look at, will these bills and regulations pass, which is going to put a new, well, it might be constraint considered, but when you look at the trends that are coming our way, which we just discussed, those avenues are available. And so just when when the audience is thinking about how do I implement these for my customers or for my employees, just a few things to consider to ask your partners and vendors if they're doing anything in that realm. And finally, Chuck, I wanted to talk about just, let's just spend a minute or two talking about the industry, who benefits here, and kind of the who and the how across of this evolving technology, how we're advancing and modernizing health plan tech.
Sure. Can you hear me okay, Jason?
Yes.
Okay, great. Just want to make sure. The challenge for anyone that has major investment in healthcare, as employers do, in trying to get their employees engaged as well as the families engaged, in the past has been a challenge because they've gone to wellness programs and they've been somewhat disappointed because they would spend a lot of money and get very little involvement until they realized you needed to incentivize them. Your program here has an incentive component that is very fascinating because it's now providing feedback through technology where a lot of people now are very comfortable. So that's great. The employers that are at risk, you get into a self-funded employer, for example, and they've made a significant investment in trying to find the best way to manage that risk and have the payback that they're expected, and that they can also show in some way that through their management reports, they can show that there's actually change without getting involved in HIPAA issues and the keeping the data obviously masked so that there's no concerns there. This is a unique way to bridge that. We've now had with this, from what you're discussing here, it's unique in that not only are you capturing the data, you're finding a way to get that information back in a very usable manner. And that's what employers are looking for. If the employees will get comfortable with it and their families will use it now under this issue, as Rania said, you got so much under the COVID atmosphere of being able to get people engaged. And I think this is great. That's really is what this is going to allow employers to do.
Great insights. Thank you, Chuck, and thank you, Rania, as well. So let's go ahead and open this up to a little bit of Q&A. So let me check out what we got here. So, and looking at the first question, this looks interesting, Chuck. I think it kind of covers what we just talked about, but this says, we looked into wellness programs, but never thought we could get employees interested in participating. How do you foresee that in the light of everything that's going on? How do you get employees engaged and families engaged through technology? I think to answer that, I think I go back to how we're modernizing in not only whole system design, but in the health tech 3.0 philosophy of innovation, we're more customer experience centric, right? We're focused on the customer experience. There are countless studies, surveys, articles, blogs talking about the lack of utilization of current health technologies, whether it's portals, whether it's apps, or so on and so forth. But by modernizing that and speaking your end user's language, you're now gaining their trust, which in turn feeds adoption, understanding, engagement, and will drive participation in the programs that can cost pretty dear, right? So it's very important that you look into how you're extending technology to your employees and their families to make a difference. Sorry, I got one more of these. Let me see. The next question is, how do self-insured employers drive down their costs most effectively? And would like to hear from Chuck and Rania. So how do self-insured healthcare employers drive down their costs most effectively in the context of using modern technology?
I'll take a first shot at this, Rania. The employers are relying on the delivery system that includes a third-party administrator and consultants and brokers. And the most important thing is for the employers to make sure that the RFP process, where you're trying to find out the correct TPA to help you manage this cost, and the correct brokers or consultants to help educate your employees on how to maximize the use of these new systems. I think that one of the critical things is to make sure that the employers that are self-funded are requiring their partners, TPAs and brokers, to be very active in addressing this change in communication with employees.
Yeah, and to sort of add on to that, I think it's working with the TPAs and the vendors that you're working with is looking at the data, right? What does the data show you? What is being utilized, what isn't, so that you can evaluate, on a year-by-year basis every time you're making a decision, which programs you continue to provide, particularly on, let's say, the wellness front. There's, explosion of wellness programs, but most are underutilized, and finding ways to engage the employees. And so I think to your point, Jason, we talked about, it's not just data, right? There's prescriptive data. Then there's sort of data that tells you what are you supposed to do with it, right? What are the action items? Like, can you evaluate on a year-by-year basis? Well, this program cost this much money and was underutilized and is really not worth it to continue, but this other program was highly utilized. Is there a way to better leverage that? And so I think it's using data to evaluate where you're spending money and making sure it's effective. Now, in some cases, there's also sometimes you're offering things because there's an expectation that it's being offered, even if it might not be utilized. It's more of, in essence, a marketing benefit to that. But, it's looking at that data as well, too. And again, I think one of the great things about the modernization of health plan technology is now you have this data, and then you need a system that tells you what to do with that data. And so how do you make decisions from that?
Yeah, really good points, both. Thank you. We'll take one more question here. Let's see. How can Unna help with telemedicine programs that we just started? And really it's Unna, and there's other platforms as well. And this is when we start talking about being an open system. In looking at your telemedicine, your telehealth solutions that you're deploying, what do they do with the data? Are those integrated with electronic health record systems? How are they getting clinical data? Where's that data go? And because that data is also very valuable, unlike a in-person where there's a lot of interaction and you've got a scribe. Telehealth can be varying on the other end of where the data goes. What are the outcomes that are recorded? So all of that can come into the ecosystem. So in terms of deploying modern health plan tech, you actually want to make sure that those types of vendors and partners have good interoperability capabilities, so that you can bring in all that data and keep it into the fold, so that you're not missing a beat or missing a step or losing any data in the interaction, right? And my final thought on that too is also, when you're looking at telemedicine, really zero in on their HIPAA compliance capability and security, because that's going to be a constant concern for employers, for people, for physicians, and regulators as well. So I think that's, I'm going to do one more. So we mentioned actionable insights, and can the panel offer some examples here? And I'll start off, and then I'll turn it over. I mean, actionable insights can come in a number of forms, and it can be everything from real time at the member level for instead, we know it's time to fill your insulin. Don't go here. If you go a mile over here, you're going to save 25% and earn 5,000 points of rewards. That's an actionable insight delivered in a seamless automated fashion that just saved money in a very easy fashion, right? And I'll just take it to one other level. At an organizational level, with the inclusion of multiple data points using modern technology, employers may understand really quickly that, hey, look, we can save on absenteeism. We can save on presenteeism by putting an on-site clinic. And your prescriptive or actionable insight should be telling you, here's how much money you can save in years 1, 2, and 3 by doing this. And it knows that because how much time off are people taking when they go see their doctor? Is it a 20-mile drive? And here's the benefits of putting an on-site clinic. So those are two easy off the top of my head ones. So Rania, do you have any input in that realm?
Yeah, to piggyback on one of the examples that you used, it's also looking at, where people are getting care. Can you, in addition to reward points, maybe $500 bonus to stay in network to get a procedure done at a particular place? Are you looking at your data and seeing that there's, certain types of procedures or certain conditions that are coming up, putting programs in place like that? And even with something like COVID, right? Is your population at high risk? Can you implement something real time as, let's say, a pandemic happens, or maybe it's flu season, right? Can you look at that to sort of see what your data is showing that you can provide additional value-added programs to your employees?
Awesome. Okay. Chuck, do you want to add anything there?
Yes, I do have a thought. Actionable insights from the standpoint of the employer and maybe their HR department. We're now going to have a partner with whichever organization they're working with that is going to have feedback information as far as either reports and or consulting work on what the employees are finding important in their benefit plan. And that's critical from an HR standpoint in designing where you're going into the future and the changes you're going to invest in as far as benefit design, as far as the way you communicate with the employees, because there are report cards that can be generated out of this that give an employee changes over time. That's all very valuable information from an HR standpoint. And that's the kind of partner the HR companies, that HR people, experts I'm talking to are looking for that kind of help.
Great. Great. Okay. Well, I'm going to wrap it up from there. Listen, if you have your phone in front of you, go ahead and snap that QR code right in front of you. Reach out to me, and I would love to talk with you. No selling. I'm happy to spend an hour on the phone with you, talk with you about where you are in your technology, where your pains are, where your gaps are, and I'm happy to advise on, from what I know, what's coming down the pike, what you should be looking at in terms of your roadmap, and are you ready for certain things that are coming in the new normal, okay? So thank you to my panelists. Thank you to everyone who's joined us. Again, I will share out this recording here momentarily. And please, when you hang up, please take 30 seconds and take our survey, okay? Chuck, Rania, thank you for your time. It's always a pleasure.
Thank you.
Likewise.
Yeah. Thank you, everyone. Have a great day.
Bye.